Hey everyone, and welcome back for another deep dive with us. Today we're tackling a topic that's close to the heart of any pet owner: brain tumors in dogs and cats, and specifically how radiation therapy is being used to treat these conditions. We're going to be relying on some recent insights from a veterinary clinical practice publication. I know this can get pretty complex, but don't worry, we're here to break it all down for you in a way that hopefully makes sense.
Yeah, for sure. This publication is a great one to dive into. It really does highlight some of the latest advancements in the field.
So the publication focuses primarily on external beam radiation therapy, or RT, as it's often called. Can you talk a little bit about why this is becoming a go-to treatment for brain tumors in our pets?
Well, there are a couple of key reasons, I would say. One, RT has a relatively low side effect profile compared to some other treatment options. And two, it's becoming increasingly accessible. So that means more and more pet owners have the option to consider it for their furry family members.
And that accessibility is really a game changer. Now, I know I was reading that most brain tumors in dogs and cats aren't actually biopsied for diagnosis. Is that just because it's too risky?
Yeah, I would say that's the main reason, both the cost and the inherent risks associated with brain biopsies in animals. So veterinarians really rely heavily on imaging for diagnosis, particularly MRI. And accuracy rates of MRI for this purpose are actually surprisingly high.
Oh, really?
Yeah, around 70% for primary brain tumors in dogs, 93% for secondary tumors, and 82% in cats.
Okay, those are impressive numbers. So given all of those diagnostic tools, in what situations would a veterinary oncologist recommend radiation therapy?
Okay, so that's a great question. RT is often recommended for primary brain tumors, like ones that can't be surgically removed, or after surgery to try to prevent the tumor from coming back. It's also used for secondary brain tumors. Those are the ones that spread from cancers like hemangiosarcoma or carcinomas. And it can also be helpful for managing inflammatory diseases, things like meningoencephalitis of unknown origin, or MUO, as well as multifocal cancers, so things like CNS lymphoma and histiocytic sarcoma. And in those cases, it might be used alongside chemotherapy or drugs that help modulate the immune system.
So there's a pretty wide range of scenarios, it seems like, where radiation therapy could be a viable option. What is the most crucial thing that you think pet owners need to understand before even starting down this treatment path?
I think the most crucial thing is communication, an open and honest discussion between the veterinary oncology team and the pet owner to really discuss the goals of treatment, the potential costs, the possible side effects, and the likely outcomes. I think that shared understanding is vital.
That makes total sense. And, this isn't a quick fix, right?
Oh, no, absolutely not. Neurological improvement can be a very gradual process, including things like getting seizures under control. It takes patience, dedication, and really a commitment to lifelong monitoring at home.
So let's say a pet owner decides to pursue radiation therapy. What kind of evaluation happens before the treatment even begins?
Well, first, there's a thorough physical and neurological exam. Then there's blood work and urinalysis are done to rule out any other underlying health problems. One really interesting finding is that studies have shown that over 20% of dogs with primary brain tumors also have other unrelated tumors in their bodies. So additional imaging of the abdomen and thorax is really recommended to kind of get that complete picture.
Wow, that's a pretty significant percentage.
It is.
So it really highlights the importance of that kind of comprehensive pre-treatment workup.
Absolutely. Now, when we move on to the actual radiation therapy itself, there are different approaches that we consider. Broadly speaking, we have what's called definitive intent RT, which aims for long-term tumor control, so ideally for a year or more. And then we also have palliative intent RT, which focuses primarily on managing pain and improving the pet's quality of life for a shorter period of time.
Okay, so within those two sort of broad categories, are there variations in how the radiation is actually delivered?
Yeah, there are. We have traditional fractionated RT, which is often shortened to FRT, and then we have stereotactic RT, which is also known as SRT.
Can you break down those two options for us a little bit?
Yeah, so with FRT, the radiation is delivered in smaller doses over multiple sessions, typically 10 to 20 daily fractions spread out over a few weeks. SRT, on the other hand, delivers a more concentrated dose of radiation in fewer sessions, usually somewhere between 1 and 5.
Okay, so what are the advantages and disadvantages of each approach?
Well, SRT is attractive to many pet owners because it involves fewer trips to the veterinary hospital for radiation treatments, which means fewer anesthetic episodes for the pet. And this can be less stressful for both the animal and the owner. However, SRT requires a well-defined tumor that's clearly visible on imaging. And there might be a slightly higher risk of long-term side effects. FRT, on the other hand, might be preferred for larger tumors that aren't as clearly defined, or in cases where the tumor wasn't completely removed during surgery. FRT also allows the veterinary oncologist to make adjustments to the treatment plan as needed during the course of treatment.
So how do they go about creating a radiation treatment plan for each individual patient?
It's a very personalized process. They use CT scans and MRIs to carefully map out the tumor and the surrounding tissues, taking into account the tumor's size, shape, and location. They also consider the sensitivity of the surrounding brain tissues to radiation.
It sounds like a lot of precision is involved.
Oh, absolutely. To make the treatment even more precise, they often use a technique called intensity modulated radiation therapy, or IMRT. This allows them to vary the intensity of the radiation beam, concentrating it on the tumor while minimizing exposure to the surrounding healthy brain tissue.
IMRT, got it.
Mm.
Are there any other techniques that they use to ensure accuracy during the treatment?
Yes, there's image-guided radiotherapy, or IGRT. This involves taking images immediately before each treatment session to verify the patient's positioning and make any necessary adjustments. It's like a double check to ensure pinpoint accuracy.
So they're essentially fine-tuning the treatment right before each session.
Exactly. It's all about minimizing the risk to healthy tissues while maximizing the effectiveness of the treatment. Now, once the radiation therapy is complete, what comes next? That's the burning question.
Yeah, that's what I was going to ask. What does follow-up care look like for these patients?
Well, brain tumors are rarely completely curable, so lifelong monitoring is essential. The frequency of those follow-up visits will really depend on the individual patient, but regular physical and neurological exams are a must. Repeat imaging might be considered down the line, but, cost and the need for anesthesia can sometimes be limiting factors there. And it's important to note that anti-seizure medications are often continued even after the radiation therapy is complete, because seizures can still occur.
So it's really about managing the condition long term and helping the pet maintain a good quality of life for as long as possible.
Yeah.
Speaking of which, what are the potential side effects that pet owners should be aware of when it comes to radiation therapy?
That's a really important question. Side effects can vary quite a bit, and sometimes it can be tricky to distinguish them from symptoms related to the tumor itself. That's why imaging plays such a crucial role in monitoring these patients. But to give you a general overview, we can kind of categorize side effects based on when they tend to appear. Paracute side effects are rare, but they can happen within 48 hours of a treatment session. They might include things like seizures, changes in mental state, or even difficulty recovering from anesthesia. Acute side effects are more common, and these typically show up between 1 and 6 weeks after radiation therapy. They often involve things like increased sleepiness, which can usually be managed by adjusting the pet's steroid medication.
Okay, what about side effects that might show up later on down the road?
Yeah, good point. There are also what we call early delayed side effects, which can emerge anywhere from 1 to 6 months after treatment. These might include things like seizures or neurological decline. These usually respond well to steroids, but in rare cases, they can be more serious and difficult to manage. It's thought that these might be more common with SRT than with FRT.
And are there any long-term side effects that pet owners should be aware of?
Yes. Late side effects can sometimes develop months or even years after radiation therapy is ended. These could include things like seizures, changes in mentation, or even the formation of secondary tumors in the brain. It's really important to remember that these late side effects can mimic the progression of the original tumor, which is why ongoing monitoring and imaging are so crucial to make sure we're addressing the right issue.
So even after the radiation therapy is finished, it sounds like vigilance is key. Now let's talk about prognosis. I mean, that's really the crux of the matter, isn't it?
Yeah.
What can pet owners realistically expect in terms of outcomes after radiation therapy?
Well, it's a complex question. And the answer really depends on a variety of factors, including the type and location of the tumor, the individual pet's overall health, and the specific treatment protocol that's chosen. Sadly, for dogs and cats with brain tumors who are only treated with medication to manage their symptoms, survival times are generally quite short, typically less than 1 to 6 months.
That's heartbreaking. Does radiation therapy offer any hope of extending that time frame?
It does. Studies have shown that RT can significantly prolong survival times, potentially by years, and it can also improve the pet's quality of life during that time. This applies to dogs and cats with a range of different brain tumors.
Can you give us some concrete examples from the research cited in the publication?
Certainly. For dogs with meningiomas treated with radiation, median survival times range from 19 to 25 months. That's a significant improvement compared to an average of 7 months with surgery alone.
Wow, that's a remarkable difference. What about other types of brain tumors? How do they tend to respond to radiation?
Well, for gliomas in dogs. Recent studies using both FRT and SRT have reported median survival times of 1 to 2 years, which is a promising advancement compared to historical data. And even for trigeminal nerve sheath tumors, which are notoriously difficult to treat, SRT has shown median survival times ranging from 441 to 952 days.
Those numbers are encouraging. It sounds like radiation therapy is offering real hope for extending and improving the lives of pets facing these difficult diagnoses.
It is, and it's important to note that in some cases, combining radiation therapy with other treatments like chemotherapy can further enhance those outcomes. For instance, one study found that adding chemotherapy to SRT for canine gliomas increased the median survival time to over 658 days, compared to 230 days with SRT alone.
Wow, that's incredible. Are there any specific insights into how different types of brain tumors respond to radiation?
Yeah, the publication delves into this in some detail. For example, for meningiomas in cats, surgery is often the first line of treatment, with an average survival time of 37 months. While post-operative radiation is an option, there's limited data on long-term outcomes in these cases. However, it's generally thought that cats respond similarly to dogs.
Interesting. What about those less common types of brain tumors, like choroid plexus tumors?
Yeah, choroid plexus tumors are kind of unique in that they can spread throughout the ventricular system, creating what are called drop metastases in distant parts of the brain and spinal cord.
So in those cases, early detection and thorough staging are even more critical.
Absolutely. Ideally, both CSF analysis and MRI of the entire brain and spine are recommended to get an accurate picture of the extent of the disease. If it's localized to the brain, radiation therapy, either FRT or SRT, can be considered. However, if multiple lesions are present, more extensive treatment like craniospinal radiation or chemotherapy might be necessary. Unfortunately, there isn't a lot of research on long-term outcomes for choroid plexus tumors treated with radiation. One study using SRT in dogs showed a median survival time of 515 days, with most dogs experiencing clinical benefits, but a significant portion of those dogs were euthanized within a few weeks of treatment, which highlights the aggressive nature of this particular type of tumor.
It sounds like for choroid plexus tumors in particular, early diagnosis and a clear understanding of the prognosis are paramount.
Precisely. Now let's shift gears a bit and talk about trigeminal nerve sheath tumors, or TNSTs for short. These tumors often present with atrophy of the masseter muscle and can lead to compression of the brainstem.
And I recall reading that surgery isn't usually a feasible option for these tumors because of their location.
That's right. So radiation therapy often becomes the primary treatment modality. Several studies have investigated the use of SRT for TNSTs in dogs, and the results have been somewhat mixed. While median survival times have ranged from 441 to 952 days, some dogs experience persistent neurological problems even after treatment. These issues can include things like facial pain and problems with their eyes.
So while radiation can slow down the tumor's progression, it might not completely resolve all of the clinical signs. That's an important consideration for pet owners.
It is. Setting realistic expectations is key. Now, moving beyond tumors that originate within the brain itself, let's touch on tumors of the skull that can also impact the brain.
You're talking about things like multilobular tumor of bone or MLO.
Exactly. These tumors can press on the brain, leading to neurological dysfunction. Radiation therapy is often a crucial part of treatment, especially since complete surgical removal is rarely possible. One study using SRT as the sole treatment for MLO in dogs showed a median survival time of 329 days, with a significant reduction in tumor volume in most cases.
That's encouraging. It sounds like SRT is proving to be a valuable tool for managing these challenging skull tumors.
It is. It's also worth mentioning that both CT and MRI are typically used in these cases to get a comprehensive view of the tumor's extent, both in the bone and within the brain itself. This helps ensure optimal treatment planning.
Makes sense. You need to see the big picture before you can effectively target the tumor.
Precisely. And in cases where surgery is possible, but the margins are narrow or incomplete. Additional radiation therapy can be used to reduce the risk of local recurrence.
So it's like adding an extra layer of protection.
Exactly. It's all about maximizing the chances of long-term tumor control. Now, beyond tumors, radiation therapy can also play a role in managing certain non-neoplastic inflammatory conditions of the brain.
Like MUO, which we touched on earlier.
Yes, MUO is a prime example. Studies have shown that radiation therapy, often in the form of whole brain irradiation, can be beneficial when used alongside medical management, It can lead to clinical improvement and extended survival times. For dogs struggling with this, often frustrating and difficult to treat condition.
That's good news for those dogs.
It is. And similar approaches with whole brain irradiation can be considered for multifocal neoplastic diseases, like lymphoma or histiocytic sarcoma. Although research on long-term outcomes in those cases is still somewhat limited.
So it seems like the field of veterinary radiation oncology is constantly evolving, with new applications and refined techniques emerging all the time.
Absolutely. It's an exciting field to be a part of. We're constantly pushing the boundaries of what's possible and offering new hope for pets facing these complex neurological conditions.
Yeah, it really is inspiring to see the progress that's being made in this field. As we wrap up our deep dive today, what are some key takeaways you hope our listeners will walk away with?
I think one of the most crucial things to remember is that radiation therapy is becoming an increasingly valuable tool in the fight against brain tumors and other neurological conditions in our pets. And while it's not a cure, it offers a real chance at extending life, improving quality of life, and providing hope in situations that were once considered hopeless.
Absolutely. And as we touched on earlier, early detection and diagnosis are incredibly important.
Yeah, I couldn't agree more. The sooner we can identify a brain tumor, the more treatment options we have available, and the better the chances of a positive outcome.
From all the research we discussed today, was there anything that particularly surprised you or stood out as especially memorable?
I think the statistic about over 20% of dogs with primary brain tumors having other unrelated tumors was definitely eye-opening. It really underscores the need for that comprehensive pre-treatment evaluation to make sure we're addressing all potential health concerns.
Yeah, it really does. And the high accuracy rates of MRI for diagnosing brain tumors are also reassuring. It means pet owners can have more confidence in the information they're receiving and the decisions they're making about their pet's care.
Exactly. Knowledge is power, as they say.
Well said. Before we sign off, is there any final thought or piece of advice you'd like to leave our listeners with?
If your furry friend is facing a brain tumor diagnosis, my advice would be to stay hopeful. Veterinary oncology is a rapidly advancing field, and new treatments and breakthroughs are happening all the time. Talk to your veterinarian about all the options available, including radiation therapy, and remember that you're not alone. There are skilled veterinary oncologists and support systems out there to help you and your pet navigate this challenging path. From Vet NeuroJar, keep those minds inspired, hearts light and tails wagging.